Greetings, I am Tan Yu Qing. Today I will present on Chapter 1, Understanding the Ability Assessment for Older Adults. This chapter is structured into 4 main sections. First, what is the ability assessment for older adults? Second, assessment indicators for older adults. Third, classification of ability levels. Fourth, significance of the assessment. We will examine each section in turn. The presentation will conclude with review questions to help consolidate your understanding. First, let's explore the definition of the ability assessment. In developed countries, older adults typically refers to individuals aged 65 and over, whereas in developing countries like China, it refers to those aged 60 and over. Ability refers to the inherent conditions necessary for an individual to successfully complete a certain activity. The ability assessment for older adults is a standardized process that evaluates an applicant's capacity across 4 domains: self-care, ability, basic mobility, mental state, and sensory perception and social participation. The outcome is a determined ability level and a formal assessment report. Next, let's look at the assessment indicators, the specification for the ability assessment of older adults. GB/T42195-2022 stipulates the standardized indicators for conducting these assessments. The assessment framework is structured around 4 primary domains, which are further elaborated through 26 specific secondary indicators. These domains are 1. Activities of daily living, ADLs, 2. Basic mobility, 3. Mental state, and 4. Sensory perception and social participation. The distribution of secondary indicators across these domains is as follows. ADLs comprise 8 indicators, basic mobility comprises 4, mental state comprises 9, and sensory perception and social participation comprises the remaining 5. Activities of daily living, ADLs, refer to an individual's capacity to perform fundamental self-care tasks independently. These include eating, personal hygiene, dressing and undressing, continence, bowel and bladder control, and toileting. A precise evaluation of ADLs is critical for developing personalized care plans and allocating appropriate support resources. Basic mobility encompasses the physical capacity for fundamental movements, including positional transfers, in-bed transfers between a bed and a chair, ambulation on level surfaces, and ascending and descending stairs. Assessing basic mobility is essential for implementing targeted safety interventions, such as fall prevention protocols, to ensure the individual's physical well-being. Mental state is evaluated through a multi-dimensional assessment of cognitive and affective functions. Key dimensions include orientation to time, place, and person, memory, comprehension, and expressive abilities, the presence of aggressive behaviors, signs of depressive symptoms, and the overall level of consciousness. This comprehensive evaluation allows for the early identification of cognitive decline, communication deficits, and mood disturbances. It is important to note that an older adult's mental state can be influenced by a range of contextual factors, including age, educational attainment, marital status, living environment, overall health status, and functional capacity. Sensory perception and social participation capacity. Sensation is defined as the cerebral reflection of individual attributes of objective stimuli acting directly on sensory organs. Perception, conversely, constitutes the cerebral synthesis of holistic attributes of objective stimuli. Sensory function in older adults is primarily evaluated through visual and auditory acuity. Social participation capacity encompasses 3 core competencies: managing routine affairs, utilizing transportation systems, and engaging in social interactions. Systematic evaluation of these domains provides critical data for developing interventions aimed at enhancing self-worth and psychological well-being in the geriatric population. Next, let's turn to the classification of functional capacity levels. Based on the assessment scores from the 4 dimensions of self-care ability, basic mobility, mental state, and sensory perception, and social participation, the ability of older adults is classified into 5 levels: intact ability, mild impairment, mild disability, moderate impairment, moderate disability, severe impairment, severe disability, and complete loss of ability, complete disability. Intact ability level 0. The individual is fully independent in activities of daily living, demonstrates a normal mental state and intact sensory perception and communication capacity, is capable of managing household chores, and can participate in social activities. Mild impairment level 1. The individual is not fully self-sufficient in daily living and requires guidance or prompts from others for self-care. Exhibits impairments in mental state, sensory perception, and communication capacity. Demonstrates disorganized management of routine household affairs requiring supervision or guidance from others for completion, and has a limited albeit present capacity for social participation. Moderate impairment. The individual requires assistance from others in daily life, although they remain the primary agent in completing activities. Presents with a poor mental state and significantly impaired sensory perception and communication capacity. Can complete routine household affairs only with partial or substantial assistance from others, and is unable to participate in social activities. Severe impairment. The individual is completely dependent on others for daily living, may suffer from dementia with associated risks such as wandering, falls, choking, or self-harm, and exhibits severe impairment in sensory perception and communication capacity. Complete loss of ability. The individual experiences a total loss of self-care ability, basic mobility, and social engagement capacity, or is in a comatose state. Finally, the significance of the ability assessment for older adults. The significance of the ability assessment will be examined from 3 perspectives: older adults and their families, institutional care providers, and government departments. Significance for older adults and their families. Facilitate comprehensive understanding of physical and mental conditions to prevent unnecessary health deterioration. Inform the selection of appropriate care models and service options. Provide evidence-based foundation for home environment modifications incorporating assistive technologies and age-friendly adaptations. Significance for institutional care providers. Enable development of personalized care protocols with corresponding specialized equipment and professional staffing. Serve as objective criteria for determining appropriate care transitions following medical stabilization. Establish standardized reference framework for service delivery, potentially mitigating disputes regarding care cost allocations. Significance for government departments. Generate empirical foundation for evidence-based policymaking in elder care services. Inform strategic planning for tiered elderly care infrastructure development according to demographic needs. Facilitate targeted subsidy mechanism design to optimize resource allocation for vulnerable populations. To consolidate learning outcomes, please address the following competency-based questions. First, the target demographic for standardized ability assessment in China comprises individuals aged or above. Second, the assessment framework incorporates primary domains and specific evaluation parameters. Third, primary assessment domains include multiple selection. Fourth, clinical scenario. Mr. Zhou, a 70-year-old male, presents with mild visual impairment, inability to discern standard newsprint, and requires verbal guidance for daily living activities. The appropriate functional classification is: Greetings, I am Tan Yutong. Today I will present on Chapter 1, Understanding the Ability